So please unmute your mic, sir.
Thank you. So, dear friends, we have discussed the third 83 aphorism, the only early part of the 83 aphorism in the last lecture. In fact, it is the most important part of the sixth edition of Organ of Medicine, where he has explained about the qualities of the homeopathic physician for taking a chronic case. And when one goes ahead with this, there are 4 qualities Hahnemann have explained. The first quality which he has mentioned is regarding that is freedom from prejudice, that we have discussed in detail in yesterday's lecture. And to become a unprejudiced is a rather difficult task, that also I have told. And the method with which you can at least achieve some part of it is just taking the state of the person as it is, the state with which patient approaches, and finding it out what are the symptoms with which he comes out. That gives you an idea. Repertory is the best tool with which you can become more unprejudiced. And then we have started discussing about the sound senses. In the sound senses, basically the 5 senses which we have discussed, out of which first one, that is eyes observation, that we have discussed in detail. I have given you one homework to open your Kent's repertory and find it out, all observable rubric. How many of you have worked it out? Anyone have done at least something for that? In fact, it is a very good work. If you start with it, you will achieve a lot in your practice. This is too important to go with that, to understand the repertory and each and every sentence from the repertory, which is important. And for that purpose, at least go through the main rubrics, find it out whether it is visible or whether it is subjective or objective. If it is objective, just find it out, the role of it, so that you can get it many times in your practice. So first important quality of the homeopathic physician, which we have discussed over there, the sound senses, and out of which one sense which we have discussed. Second important thing is the ears hearing. First we have discussed regarding the eyes observation in yesterday's lecture. Second is ears hearing. But few things which we have not discussed in yesterday's lecture regarding the eyes vision, we have discussed only the ascertainable physical constitution. Rest of the things which are visible and which are necessary is to observe how the patient sits. What is the patient's attitude? How he enters. It is your with your visible eyes you can observe. The patient comes and opens directly a door and enters inside your room. Doctor, may I come in? He comes. Another patient who knocks on your door. Doctor, may I come in? See what you are observing and what you are listening, both things at a time, which gives you something, which is essential. The person who comes directly opening your door, what rubric you are going to consider for that patient? Because that is his nature, that is his state with which he has approached. What you are going to consider in that case? Yes, very good. Abrupt. Nature is abrupt. This is abrupt. And on the Kent's repertory, the first page, you get this rubric, abrupt. Very important rubric. Nature is abrupt. If the tone of his talking, the way he behaves with you, that gives you many things. He enters, doctor, may I come in? He is not polite enough. He directly asks. Generally, a tendency is that a normal human being is always a polite. He is not polite. In fact, he enters directly. Many a time patient comes and patient knocks your door. He asks, may I come in? And then he praise you. That is a reverence, which you observe that his nature is reverence. But certain people, those who don't have that, you can take opposite of it, reverence lack of. So you can find it out, all those things. So behavior of the patients, which you can observe and which you can listen. The tone of his talking is very important. The way with which he expresses. Some people stop. Doctor, you know that doctor, he has referred me to you. I want to show you. He has tried a lot, but he never got succeeded. He said that better to take his opinion. Another, he comes from them. I have gone to that doctor. He doesn't know anything. That's why I come to you. The tone matters. One is mild, one is polite. The another is exactly opposite. Impolite. He's dominating, dictatorial. He's abusive. So this is what you observe with your sound senses. This is what you listen with your sound senses. So everything matters. These are the things which details you the individuality of the person. You have to prescribe for the person, not for the his disease. And for that purpose, these things matter. Here you get the case. Here directly you catch the thing. The way patient presents is very important. And that's why these are the things which you can catch, perceive through your sound senses. So the way he sits like this, he sits in such manner. Some patients looks like this only. Some patients sits like this. They keep hands over there. Everyone's have their own attitude. That you have to catch. That shows individuality of that individual. And that individuality gives you a remedy for that specific person. So nature of the person can be visible and can be perceived with your observations. So everything we have to observe. Shankaran sir, in his substance of homeopathy, had explained many things. He has explained, he has made the classification of the remedy, the animal remedies, the plant remedies, the mineral remedies, and he has given one chart and few important hints. The way the person dresses, he has mentioned over there. That is also a very important thing which you can understand the nature of the person. But question, you should be very clear enough. When you observe the things, first make it clear whatever you think is right or wrong. If you look toward the patient's hairs and patient's hairs are gray, then it is necessary nowadays to ask whether have you colored them. This is very simple question which you have to ask, because people like to have gray hairs now, and that's why they colored their hair. So don't take directly the gray hairs as a rubric. So confirm the things. That is more important. If you wear certain specific shirt or dress, you ask whether it is of your choice or someone have gifted you. Why do you wear that? How, in which types of clothes are you more comfortable? So you observe and your question restarts. And that's why observation is a very important thing. Observation gives many things. Some people who comes to you and they talks in a typical tone. Doctor, त्याचं काय आहे ना? So they talks like this. What is it? It's called as? त्याचं काय आहे ना? मी डॉक्टरकडे गेले होते पण ना. What you get? This is what you have to catch. Yes, the patient is talking in this manner. This is too important. You get a rubric. No, this is not animated. This is something which is very important. मराठीत आपण काय म्हणतो? What we call this? नखरेल म्हणतो आपण, नखरेल. This is called as coquettish. Rubric is coquettish. Coquettish. Coquettish too much. That is the rubric. That you can observe how the person is talking to you. So these are the things which you have to catch. Open your repertory. You can get that rubric, coquettish too much. So such things which you have to go on observing. And those guides you a lot. So observation, it is a big thing. A whole lecture again will be there on the observation only. Because there are many more things which you can observe. And that's why make a habit that you should go on observing the things clearly and find it them inside your repertory. Again, go over there, find it out in the repertory, which are objective rubrics in your repertory from each and every chapter. Not only from the mind, but from each and every chapter. Go on finding it out. Yes, this I can observe, this I can observe, and make a separate repertory. That will be very useful for you. So first sound sense, that is the eyes observation, which we have finished. Now second important, that your ears should be very acute. You should be like that. They should work like a dog. How the dogs behave. They listens a long sound of a long distance. You should have that acuteness in your ear. Person is sitting over there outside in your consulting room, not in your cabin. You must have ears towards the reception table and listen how the person is talking, how the person is behaving. My suggestion is there that you should have cameras over there so that you can get a very clear-cut picture about the patient's nature, how they behave outside and how they behave with you. This is very important for that purpose. And second thing, keep ears very acute, alert, so that you can immediately catch. There are persons who comes over there and they talks. Tell doctor, I am there in the waiting room. They talk like this. Doctor Sanga, me aloy. And they use very big voice over there. Their expectation is that doctor should listen me. So what is the rubric? This rubric you can get very immediately over there. Patient is there, patient talks like this, and you have also listened this sentence. What he wants to try, what he wants to impose on your mind. He wants to impose on your mind, I am someone. I am important. It is not dictatorial. It is pompous. 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 Importance feels it's pompous. This is the rubric. Or directly, pompous rubric is there in some repertory. Yes, this is pompous. There are some people who talks with the reception in a different manner. They talks, don't you know that who I am? And when they enter, doctor, how are you? Their behavior is absolutely different when they behave with you, and when they behave with the receptionist, their behavior is absolutely different. Yes, you listen, you observe, and these things matters a lot, where you get the complete layer rubric. But what is the rubric, Dipali? Yes, you have said very correct, but it is in the repertory, how it is there, under which rubric it has been given. It has been given under the contemptuous. Contemptuous, hard for inferior, kind to superior. This is given in the repertory with main rubric contemptuous, hard for inferior, kind to superior. And there are 4 remedies, not only lycopodium. There is lycopodium, there is lachesis, there is sulfur. 4 remedies are there. There is platina, I think so. These are 4 remedies which are mentioned over there. So this is very important thing. One must develop. This is acuteness of hearing, the alertness of hearing, which guides you towards certain things. Even the patient's coughing outside in the waiting room guides you many things. How the person is coughing over there. Then there are some children which you observe on your screen that they are continuously moving here and there. There are certain children who are crying a lot. As soon as they entered inside your OPD, they are crying very loudly. And when they are taken out, they are happy. That sound, that shrieking is very important. This you can listen as well as observe. These, these things guides you towards the good case taking. There is no need. How is your behavior? No person will going to tell you, I am very bad doctor. No one will going to tell you. Everyone will going to tell you the good nature. Because everyone is psychotic. Everyone wants to hide their bad side. Everyone wants to show only a good side of them in front of you. And that's why you cannot get a proper answer when you ask such a question, how is your nature? He will not going to tell you the truth. And that's why it is necessary to perceive. And perceiving is always through the sound senses. So first we have discussed about eyes observation, then ears hearing. Third important is the nose smell. And this is also important. This you have to make a habit. There is a big rubric, nodes, odor, and then under which many types of odors are mentioned under the repertoire. But before that, you must know such types of odors, then you can name them. But you get those and you can get the remedy many times. There was one patient, she was having a CA uterus already with metastasis, and she was brought to me, and she had a very much severe swelling over there, total inflammation over the uh, lower abdomen on the pubic area, and it is absolutely swollen. And when I tried to examine, there was very typical smell. It was as if fish frying. That is very characteristic. That gives you, yes, this is individuality. The discharges odor fish brine. You get the repertoire, you open the repertoire, you find it out the remedy, and that is the characteristic of that patient. There are certain patients in which you have a typical smell, a sweety smell, like thuja, very offensive smell, like a murk salt. So odor is one important thing which guides you to find it out exact characteristic of that individual. And those are very, very essential. And that's why your nose always should be an alert one, which can grasp the smell, odor, and with which you can find it out a certain thing. Many people comes to you, they uses the deodorant. If they are having using the deodorant, what happens? This deodorant, because of deodorant, they have many allergies also. So if you feel that patient is using the deodorant, it is your duty to tell him that it should be stopped, because it creates a lot of problems. It itself is the thing which suppresses the perspiration and can lead to disorder. It is a danger. You have to ask them to stop that. So this is one more thing which one should not forget. So third important is the nose smell, third sound senses, which has a meaning in homeopathy. And last one, but very important one, is the touch, the skin touch. Touch is very important. What you can get with the help of touch? Which are the things which are very important, which you can catch with the help of touch? Anyone? It is the first important thing when patient comes with the basically with the specific pain, and if you start him examining the tenderness, that is more important. Pain on pressure or pain on touch, tenderness, which you can find it out, but that is a very superficial aspect of looking the thing. What is more important for you with the help of touch? First important, with the back of the hand, with which you can find it out the temperature. If the patient comes to you with a joint pain, you just check the temperature of the joint. That is more important. It is with the back of the hand. Compare it from right to left. Compare it with different parts of the body. So you can confirm whether it is really swollen, whether it is really an acute inflammation, or it is just a edema or effusion. So that comes with the help of touch. Second important thing, you can touch the palms of the person and find it out whether they are dry or whether they are moist. You can find it out the temperature of the palms, whether they are hot or cold, with which you can understand patient in a better aspect. Then you can take the pulse. Again, a touch is important. And if you take the pulse, we have lot of sub-rubrics in the pulse generalities chapter. Open the generalities in the Kent's repertory and find it out the pulse. You can get many rubrics, sub-rubrics under the pulse. Make a habit of using this. You can get many more things. Lot of things you can just get with the help of pulse. See, every aspect of clinical examination guides you towards the something. Don't miss clinical examination. Many homeopaths miss the clinical examination. I'm I'm telling you that it is very important, which guides you many things. Just see that patient's palms, certain patients who comes to you, their palms, hands are absolutely cold. Absolutely cold. And if you touch their head, it is very hard. It is very hot. So these are the things which you have to understand. The things are given in our materia medica, but which we never use because we never use our all senses properly. So these are 4 important senses which are very useful in your practice in order to understand the human being. Out of these 5, we have discussed 4. The 5th one is not necessary, but one more, which is called as 6th sense, is very important. And what is the 6th sense? What is 6th sense? Anyone? Sixth sense gives you, it is nothing but the perceiving. Sixth sense understands many things regarding the nature of the person. Depending upon the patient's behavior, you can catch many things. Not clear ones. Clear ones is a different, and sixth sense is little bit different. When you look toward the patient and you think about something, immediately is the sixth sense. Clairvoyance is about future. It is prophesying. That you can explain in your prognosis is prophesying or clairvoyance. But here, when you with your sixth sense, you can catch many things. The patient is discussing something with his relatives or with his attendants, and on the basis of which you can catch something, that is your sixth sense, which is working. They are talking, but you are getting some information that is your with your sixth sense, because you are using your logic at the same time. And that is also very important. That you gradually gets developed when, as you start homeopathic practice and gradually become senior, you start developing all those things. So sound senses is second important quality one should not forget. So in yesterday's lecture, we have discussed first quality, that is the freedom from prejudice. And today we have finished with the sound senses. The third important is attention in observing. Attention is observing. Already we have finished a lot, because observation comes in sound senses. But regarding the patient's behavior, it is related with that. Attention regarding how the patient sits, how he behaves, the way he presents himself, that all those things which you can catch over them, that is the attention in observing. So you should be very, very, very keen regarding the observation. That is what is called as keen observation. The patient comes to you and you just look toward the patient and you observe that there are fever blisters. It is very much is necessary to catch that. Yes, this is there, which guides you towards many things. It is the rubric which is there. There are not, we used to learn materia medica, and with the help of materia medica, we reach only towards two remedies. One is the Rustox, and second is natrum. But if you open the repertory and go through the rubric, that is on the first chapter, the eruption, vesicular, and under which the fever blister. This is the rubric which is given in the complete repertory. And you can get many more remedies under that. So this is the thing which one should observe. This comes through the attention in observing. The face greasy face you can catch very easily, immediately. So everything related with the patient you can catch with the help of attention in observing. I think we'll stop over here in today's session. We have finished the first, freedom from prejudice, second, the sound senses, all four senses along with the sixth sense which we have discussed, and the third one, attention in observing, that already we have finished, because we have discussed a lot about the observation. So that's all for today. Thank you very much being there. If you have any query, we can discuss, or otherwise we'll join directly on Monday, not tomorrow. Tomorrow will be the holiday. I think yesterday there was problem with the Divine School session. So Dr. Moin sir, he will going to take session tomorrow at 9 o'clock. Okay. So thanks a lot, and we'll meet again. Thank you.